It is better to understand diseases of the kidney is to get a brief introduction about anatomy and structure of the kidney and the urinary system. In our bodies, we have two kidneys. Each kidney lies at the side of the vertebral column. Each kidney is about 150 grams in weight, and they are at the level between T12, thoracic 12, and lumbar 3. Both kidneys are retroperitoneal structures, and so the view which we are seeing is not the view which we'll see if we go anatomically from the anterior abdominal wall backwards, but many organs and the peritoneal organs removed from this picture because the kidneys are retroperitoneal structures which are resting on the posterior abdominal wall muscles. The right kidney is slightly lower than the left one because of the presence of the liver, which pushes the kidney downwards, and so the lower edge of or lower pool of the right kidney is lower than the left lower pool. Each kidney takes blood supply from the abdominal aorta, which gives origin to a single renal artery to each kidney and drains through a single renal vein to the inferior vena cava. If we go further step, we are looking now at the urinary system. We are looking at both left and right kidney, ureter, bladder, and urethra. There is cross-section in the left kidney, which showed that the kidney has two parts, had outer part which called the cortex, which is about 20 millimeter in width. The cortex is very important as 85% of the glomeruli are cortical. Glomeruli are the filtering power of the kidney. So if you receive a scan report telling you that there is paper-thin cortex or atrophied cortex, this means that severe damage happened to this kidney. The inner part of the kidney is called the medulla, and the figure shows us the formation of the drainage system of minor calyces, and minor calyces coalesce together to form major calyces, which will coalesce to form the renal pelvis or ureteric pelvis. Each ureter opens with a single orifice into the urinary bladder, and the urinary bladder will act as a reservoir of urine and excrete the urine through the urethra. Each kidney gets blood supply through a single renal artery from abdominal aorta. Sometimes you can find accessory renal arteries, but usually it is a single renal artery. And it drains through a renal vein into inferior vena cava. Dimensions of the kidney. The length of the kidney is about 10 to 12 centimeter long. The thickness is 3 to 4 centimeters, and it is 5 to 6 centimeter wide. Looking at the coverings of the kidney, there are four coverings of the kidney. The immediate cover of the kidney is the renal capsule, which is immediately attached to the kidney and envelops the kidney. And outside the renal capsule is the perirenal fat. This perinephric fat separates the kidney and the capsule attached to it from the fibrous fascia, which is this layer. And the fibrous fascia puts a separation between two types of fat, the perinephric fat and the pararenal or paranephric fat. So we have four layers: the capsule immediately attached to the kidney, and the perinephric fat, and fibrous fascia, and paranephric fat. Kidneys, which are retroperitoneal structures enveloped in four coverings, have relationships to adjacent organs and structures. First of all, each kidney is capped by a adrenal gland or suprarenal gland. And it is of note that the perinephric fat and renal fascia and paranephric fat, they all envelop the kidney and adrenal and support them to the posterior abdominal wall. Superiorly, The kidneys are separated from the pleura and 12 strip by the diaphragm. And this is very important information because the kidney is a subdiaphragmatic organ, which means that it will move vertically up and down with movement of the diaphragm, with inspiration and expiration. It has certain clinical implications during the examination and feeling the lower pool of the kidney by asking the patient to take deep breathing, and also during performing a renal biopsy, as we ask the patient to take deep inspiration and hold to get the biopsy from the lower pool of the kidney. There are posterior anatomical relations, and the posterior structures are mainly muscles. So there is a posterior relation with muscles like quadratus lumborum, transversus abdominis, and psoas muscles, along with some nerves and vessels like the iliohypogastric, ilioinguinal, and subcostal nerves and vessels. The liver and second part of the duodenum and ascending colon, they lie anterior to the right kidney. So we'll find here, this is the kidney behind, and this is the duodenum, and this is the colon, and the liver is up here. So the right kidney has relationships anteriorly with the liver, duodenum, and the ascending colon. The left kidney has relationships with the spleen, pancreas, and the stomach, and also the jejunum and descending colon as well. They lie all anterior to the left kidney. The medial part of the kidney is called the hilum of the kidney. And the three important structures are in the hilum: the renal artery and renal vein and the renal pelvis. So the renal artery goes inside the kidney, the renal vein leaves the kidney to go to inferior vena cava, and the renal pelvis leaves the kidney to form the ureter to drain the urine. At the same time, there are some lymphatics and nerve plexus pass into the sinus of the kidney. If we go a bit deeper, we will find that the functional unit of the kidney is called the nephron. And we have 1.2 million nephrons in each kidney. And we will discuss this in details in the section of the renal physiology. But simply, each nephron is formed of the glomerulus, which is the filtering unit, and proximal convoluted tubule, and lobe of Henle, descending and ascending limbs, and convoluted tubules and collecting ducts, which will coalesce at the end to form the minor calyces and then major calyces and the ureter. As we understood from previous slides, that the kidney is formed of cortex and medulla. And as we mentioned, the nephrons are the structural and functional units of the kidney that form the urine. And we have two types of nephrons. We have cortical nephrons, which are mainly in the cortex with short tubules extending to the medulla. This is the border between the cortex and the medulla. Or we have other types of nephrons, which we call juxtamedullary. Juxta means beside. So juxtamedullary nephrons, which are nephrons at the lower cortex beside the medulla, and it has long tubular structures which appears as rays in the renal pyramids. Before we finish, it is better to get some clinically applied anatomical points. First one, the kidney is a subdiaphragmatic structure which moves vertically. This is important in clinical examination as you could feel the lower pool of the right kidney on deep inspiration in thin persons. The right kidney lies 1 to 2 centimeters lower than the left kidney due to its relation to the liver who is pushing the right kidney down. Also, in looking at renal mass, the kidney moves vertically with inspiration, as we will see in the next slide. And also, on doing renal biopsy, we ask the patient to take deep breathing and hold to get the biopsy from the lower pool of the kidney. Second point, which is important, there are two types of pain coming from the urinary tract. The kidney is a compact structure, compact organ, and therefore the pain coming from it is a renal pain. While the ureter, which is a hollow tube, the pain would be spasmodic or ureteric in origin. And the ureteric colic, it happens in the flank and radiates to the front and to the groin, to the areas supplied by dermatomes from T11, T12, L1, and L2. We mentioned the importance of the perinephric fat and paranephric fat in support of the kidney to the posterior abdominal wall. Therefore, people who lose big amount of their body weight and body fat in short time, this could affect the support the fat is giving to the kidney, leading to ptosis of the kidney. Also, we mentioned that the length of the kidney is 10 to 12 centimeters. So when you get small sized kidneys, 9 centimeters or less, this indicates chronic kidney disease. A final point, how to differentiate a mass in the left upper quadrant, if it is a kidney or it is a spleen. If it is a splenic mass, you cannot insinuate your fingers between the swelling and the costal margin because the spleen lies under the ribs and the costal margin directly. While in case of the kidney, because the kidney is a retroperitoneal structure, you can insinuate your fingers between the swelling and the costal margin. At the same time, the spleen has a notch, so you can feel the splenic notch in splenic swelling, but in kidney swelling, there is no notches. Also, by percussing the renal angle, it is resonant in case of splenomegaly, but it may be dull in case of renal swelling. And the direction of movement with respiration is different. So if you ask the patient to dig deep inspiration, so the spleen moves freely with respiration, but in oblique direction, downwards and to the right, while the kidney moves vertically upwards and downwards. I hope this was helpful.